So I'm going to share with you a little sense of how I contour my breast tumor bed and how I do that using the VeraForm marker. So here's a patient who had a 2 cm right breast cancer that was resected by the surgeon, fairly large tumor bed, as you'll see. And the question is what is going to be contoured and what's going to be part of my target volume, because I really want to know what's tumor and what's not. So first thing I do is make it a little big. I then identify the VeraForm, which I can see here at various points. Those points, I typically create a contour. I know that those are in tissue surrounding the tumor and that there is no reason to think that there is any tumor bed outside this contour. I know that because I know how my surgeon places those. This is where I'm going to contour the tumor bed. And here you can see again, just following the contours of these. I'm not doing it on every slice. I'm just giving it a little in between there. I'm going to let the computer interpolate this. And now here we go. And that's actually the extent of the tumor in that direction. Maybe I missed a little bit there. So now I don't see anything here posteriorly, but I know from the level above and below that there was something there. So I'm going to cross that over there, bring it all the way down. I've got some VeraForm that is here, a little bit that comes over here, and close that as one contiguous volume. Here's a little bit more. All right, and now I can see three-dimensionally. You can see it on the sagittal view. You can see it on the coronal projection. We can let the computer interpolate those, and we have a tumor bed. Now, obviously, for planning purposes, you're going to expand that. You're going to treat something a little bit different. But what I want to share with you is the sense of what would you have done without that? Because historically, we've treated the area of density, recognizing that there's area of density in the breast, even in the unoperated breast, but we've treated this area of density as the area that we need to target. And so I've actually contoured that independent of the VeraForm, and this is what it would be if I was just contouring looking at where is the density within the breast. And you can see that for the most part it's fairly close to what we've got. So the VeraForm here is in yellow, the density is in pink. You can see there's some significant overlap, but there's also a significant amount of discontinuity between these two. There's areas that would not have been contoured by density, and there's areas that are over contoured by density. And so this is one of the things that I think makes the VeraForm such a powerful tool for the radiation oncology planning process.